Hi everyone, my name is Michelle. I'm a volunteer with the LDAA and I'm here today to chat to you about the current step-by-step guide that we are releasing in relation to the National Disability Insurance Scheme. The aim of this is to allow accessibility of information to all within the Lyme disease community so that we can increase people's access to supports over their lifetime. The NDIS provides funding to all eligible Australians living with significant and permanent disability to help support and better their life for them and their families and their carers. Every NDIS participant receives an individual plan that allows them to work towards the goals with funding provided by the NDIS. NDIS participants get to use their funding to pursue any goals or activities that they wish to achieve within their life that they require support from their funding to do. The NDIS is implemented by an independent statutory agency called the National Disability Insurance Agency, also known as the NDIA. The NDIS is unable to run without the National Disability Insurance Agency. The application process can be challenging but simple once you're able to follow along. And my aim here today is to try and help people work their way through the application process and the steps. Step one is to check if you're eligible for the NDIS. This will change depending on whether you are applying for somebody under the age of 7 or if you're somebody between the age of 7 and 65. If you're over the age of 65, you will need to reach out to another government organisation called My Aged Care, and they will be able to provide an assessment and pathway for you towards receiving access to supports. You'll see the links here on screen that will help provide some direction into where to go to check your eligibility. If you're not eligible for the NDIS, as I stated, you can reach out to My Aged Care. There are also other government programs that are available through both state and federal government, such as a mental health care plan, chronic disease management plan. Those are both available from your GP. And sometimes there are also supports available from your local council, but you'll need to reach out to your local council to see what services are available. There is a link here on screen now about the Disability Gateway and services, and that will provide you a link to services that are available through the Disability Gateway and connect you in with other supports that are also available in the community. Step two, speak to your doctors and allied health professionals to make sure they are willing to support your application. If they are not supportive of an application, you will need to discuss with them their reasons and justifications as to why they are not supportive. Each professional will have their own opinions and they will think maybe other services might be more appropriate for you than the NDIS. If you disagree with your professional's opinions, you're more than welcome to seek somebody else's opinion and or potentially find another practitioner who might be supportive of you. Most professionals are usually supportive of an application, although they cannot guarantee that your application will be successful. Step three, if you think you meet the eligibility requirements of the NDIS, you can access the application in one of two ways. Option one is to download an access request form from the NDIS website. Option two is to call the NDIS and ask them to send a form to your address. Step four, begin filling out the application form. Compile your reports and evidence from your treating doctors and allied health practitioners. It can take up to 6 months to do this step, but because it takes a long time for your therapist to write those reports and also make sure that they're accurate and reflective of your needs. Step five, have your GP or allied health practitioner complete the NDIS access request form section 2. You're not able to complete this on their behalf. Step 6, and the final step, is to submit your documentation. You should receive a response from the NDIA within 21 working days, and this is the legislated time period that they must provide a response to you. There are a number of options as to the way to submit the documentation. The most recommended option is to send it via email to the address on screen, or to post or hand deliver a copy to the NDIS or at your local area coordination office. If you decide to hand deliver or post your application, it is strongly recommended that you keep a copy of your application and also make sure that you get any submission numbers or record numbers in relation to the submission of your application. The LDAA recommends that you keep a notebook, journal, or diary to assist you with management of your NDIS application processes and record keeping, as this can become very helpful later down the track if there are any discrepancies between your records and the NDIA's records, which has been known to happen occasionally. On screen, there is a link to the relevant legislation. Please refer to this if you are having any challenges with accessing the NDIS as a first port of call to make sure that your documentation meets the relevant legislation requirements.